For our diagnostic assessment, we had Maya. Maya is a 23-year-old Hispanic female who was referred to us. She's experiencing a strong need to count under her breath when in stressful situations. She will wash her hands 5 to 10 minutes multiple times a day. And if she's in a place where she believes to be more there to be more germs, she'll wash her hands even more. And she checks behind herself every time she stands up. It was her aunt who contacted the office and gave us more information about Maya. Her aunt explained that Maya will never clean her apartment and has been hoarding various items, and that she has been experiencing these symptoms since she was 10 years old.
The symptoms that we have got from Maya are counting, washing her hands repeatedly for about 5 to 10 minutes daily, checking behind her back when she stands up, and hoarding various items, including trash. The most likely diagnosis we have come up with is personality disorder cluster C with obsessive compulsive disorder with good insight. Other possible diagnoses we have come up with are:
one diagnosis we came up with is hoarding, and the symptoms that support hoarding are Maya's tendency to never get rid of her things. Her home is so cluttered with things that Maya refuses to let go of. There is no place to sit in her home. Maya refuses to allow anyone to help her with her home or touch her things. Why this diagnosis was not likely is hand washing is one of Maya's main symptoms. And she presents with that, and that is not a symptom of hoarding. One of the comorbidities is OCD is a comorbidity of this disorder. Maya experiences an urgent need to wash her hands when she touches something she believes has germs. Maya has had this need since she was a child.
Another diagnosis that we ruled out was generalized anxiety. The symptoms that supported it, though, was that she would get worried when she was not able to wash her hands, which would lead to her counting numbers. The reason this is not likely is her worry is not over things such as future events. She is worried about specific things such as hand washing, checking over her shoulder, and counting her breaths. The comorbidities that come with generalized anxiety and OCD are that OCD can present itself as anxiety disorder, but with her presenting symptoms being obsessive over specific things, then it would be more likely OCD. For it to be classified as generalized anxiety, she need to have worries about events or activities or even the future. Maya's had these obsessions since she was around 10 years old. It is a prevalent comorbidity in OCD, but there has not been many studies done on the impact of generalized anxiety has on those with OCD.
And the last diagnosis we ruled out for Maya is psychotic disorder. One of Maya's symptoms is that she checks behind her back every time she stands up to make sure that there is nothing bad behind her or something going on or somebody behind her. This we decided was not the diagnosis for Maya because it is not her main struggle. She checks behind her back, but does not specifically because she is suspicious of a specific person, just to make sure that there's nothing bad. Core morbidities that go along with psychotic disorder is the act of checking behind her over and over would be a symptom of OCD because it would be a repetitive thing, but the symptom itself is not paranoia because she is not suspicious of someone being behind her.
Other information that we decided was needed for Maya was medical records to see if she has any underlying medical conditions. We also want her family history of mental illnesses and other medical illnesses. We feel that interviews with her parents to see if they've noticed any other symptoms when she was growing up. Also interview the school counselor and see if she has had any roommates in college and what those roommates might have to say about Maya. We also think we need to interview the former therapist that Maya was seeing in her junior high, and also interview former coworkers and supervisors from the hospital that Maya worked at. The likely courses of this illness, if they were to worsen, she could have an environmental or fire hazard in her home with all the hoarding she's doing. She could possibly lose her job with her need to wash her hands so often. It can also damage relationships she might have, present and future. Some improvements could be improved personal space and in her area. And also it could allow her to have a job in a desired field.
So when looking at cultural considerations, we looked at 4 main things. The first one being the Hispanic culture and their views on mental illness. Each culture has different ideas and different ways that they believe to treat mental illness. Her religious views, it wasn't specified what religion she went or she practiced under. So that is something we would want to consider and ask her in later sessions. And then medical culture views and like her views of her family. Because family views can sometimes be different from overall culture views. And then the last one is resources near Maya that maybe will accommodate her, because sometimes depending on where you live, you can have a close community and various resources surrounding it.
And that is our reference page.